पेट में दर्द।
मेरा नाम है नरेश, हरियाणा से, होडल से। इनका नाम है पुनित। तो इनको दिखाने के लिए आए थे हम। इनके पेट में दर्द होता है और लैट्रिन नहीं जाता, 2-3 दिन में लैट्रिन जाता है और खाता पीता भी कुछ नहीं है। बहुत दिन से है। इसको हमने मुफ्त तक दिखा लिया, 20 गोयल तक, लेकिन कोई आराम नहीं मिल रहा।
The biggest inspiration for this camp is from our Ravarshi Maharaj Ji and Didis, who have been, motivating us to do more and more for the underprivileged, which has been, of course, our main focus in Seva. But then they have been pushing us to do more and making, us do more and more specialized care, which is been the big lack here in this region and around. And that was Maharaj's aim, was to provide everybody the best care possible. So instead of sending these patients out, we are getting the best experts in town. And so we plan to basically hold multiple similar super specialty camps in times to come and continue this annually for each specialty, so that the needs of each and every patient in every aspect are met.
I'm Dr. Anand Joshi from Mumbai. This is to serve the local poor people around. I've been attached to another charitable institute in Mumbai, and I know Brajesh ji for quite some time. I had met Maharaj ji earlier also, and with his blessings and to continue a charitable trust where poor people cannot go to the main places and avail these services, I think we can come here and offer our services to the best.
So this camp was organized to address one of the commonest challenges we see in our practice. Almost every patient we see in our practice has some kind of abdominal complaint. While the small ones, we are able to address it here, but a lot of them have really challenging issues which require a super specialty and expert input. And these patients being poor, and they have less access to super specialty care in wherever places they come from. Many of these patients require endoscopies, colonoscopies, fibroscans, and those are not available with these. So that's why called the best experts from Delhi and from Mumbai. And we have got the best now scopes with us. So in this 2 days camp, we'll be addressing their medical needs by addressing their, whatever questions they have regarding their disease, making the right diagnosis, doing all kind of scopies, which is upper GI and lower GI endoscopies, doing ultrasounds, fibroscans. So we are going to establish the diagnosis and give them the appropriate treatment by the best experts available to us. We have 2 gastroenterologists in this camp. Both are very eminent gastroenterologists. One is Dr. Anand Joshi, who was one of the senior most consultants from Hinduja Hospital, Mumbai. And other is Dr. Nishant Nagpal, who is again a very senior gastroenterologist from Max Hospital chain, and he's currently at Vaishali. And then we have 2 supporting experts. One is Dr. Rajesh Arora. He's a very senior radiologist based at SGT Gurgaon. And then we have Dr. Vijay Mohan Hanjura. He's heading the cardiac anesthesia team at Artemis. He's going to be assisting all the scopies. So we have 4 great experts, and very ably supported by them is a nutritionist, Dr. Sheila ji. She's a very senior nutritionist who will be providing all the dietary guidance for these patients. We are hoping to target in this 2-day camp roughly 250 patients, and we expect roughly around 60 to 70 scopies.
डॉक्टर राजेश अरोड़ा, इसके जो प्लूरल कैविटी में लंग के अंदर वो पस भरा हुआ है, तो ये 2 महीने से ट्रीटमेंट ले रहा है। अभी इसके रिलीफ है, पहले से कम हो गया काफ़ी। हमने इसको बुलाया था कि अगर ज़्यादा है तो फिर निकालें इंजेक्शन से, पर अभी पहले से काफ़ी कम हो गया। इसको भूख भी लगने लग गई, फ़ायदा है इसको।
I am Dr. Nishant Nagpal, and my core interests are basically endoscopic and advanced endoscopy procedures. It's part of being a doctor. I personally feel that you become a doctor only to help. It's just that people over here in this institute do it for a noble cause. They do everything free. They try to do it for people. And you just feel like from within to be a part of the same system and same society. 2-3 things are my observation. One, certain things get ignored over here. Like there are people who have got blood and stools and other things which require endoscopic evaluations, but maybe due to lack of available services, they are not being done. So we are trying to provide endoscopy and colonoscopy service also today over here, which I think we are doing around 60-70 endoscopies and around 10-15 colonoscopies today here, free of cost. Plus, second thing is those people have certain diseases. Like there was a lady who has got Crohn's disease and all, so there will not be sufficient expertise available to be able to take care of those people over here. So those people can get missed. So it's important that we do some intermittent things over here so that our treatment or intervention, if can change any life, then your life becomes meaningful. I read part of his books which were gifted to me. So I read about them with me. So that's all his teachings and ideology that also inspires you. That's what you feel, that your thought process aligns with the thought process, what he tried to preach. So you're trying to be part of his legacy. Just thing is, like here, everything I personally felt, I've seen, if you ask me, there are so many dhams who send all their patients to me in Delhi.
Right.
So, but I haven't seen anyone being so selfless and so much caring for people. So even if I ask you, why are you here? Your answer will be the same. You feel happy working for this place. You feel contented working for this place. That's just the exact reason you're here and you're doing it.
जी कॉन्स्टिपेशन रहता है इसको और क्रोनिक कॉन्स्टिपेशन है, भूख भी कम लगती है और
कितना उम्र है उसका?
7 साल।
हाँ?
7 साल।
7 तो क्या होता है?
पेट में दर्द होता है।
हाँ।
और लेटरिन 2-2, 3-3 दिन में जाता है। खाता कुछ है नहीं, अगर खाएगा तो पूरे से 1 रोटी खाता है बस।
बैठो।
और अभी
ये कब से है? ये 2-3 दिन में लैटरिन
लेटरिन लोग सब पहले से ही है, कई साल से। मैंने डॉक्टर दिखा दिया, किसी हॉस्पिटल वहाँ तक दिखा दिया।
बचपन छोटा है तब से हर रोज होता ही नहीं है। जब ये होता है तो कैसे कड़क होता है?
कड़क होता है बहुत ज़्यादा। पहले मतलब
पेट ऐसा फूल गया है?
पहले पिंचर दिया था,
हाँ।
तो लेटरिन की जगह पे पिंचर लगाते थे। बिल्कुल ऐसा होता।
जब से छोटा है, बचपन से अपने आप हुआ ही नहीं
नहीं
है तो
हाँ सर।
सपोजिटरी है या when he was 6 months or 3 months, there is no, he is only having mother's milk, but he is not passing. So what we have to think is that he is having Hirschsprung. पेट बड़ा होता है?
हाँ, पेट टाइट हो जाता है।
This is a rare problem in children. They generally, in childhood, as he is saying, when he was taking mother's milk, since then he has not been passing stool naturally. They have been putting suppository and other ways to pass stool. Here the sphincter, there is normally a sphincter. The colon ends and the sphincter open when the rectum is full of stool. But here there is no sensation. Probably there is a loss of nerve. The sphincter does not get the message that there is a lot of stool. He keeps for 3 days, 4 days, then somehow they make him pass stool. It is called as Hirschsprung disease. It's a rare disorder. But we need to confirm by doing, there is a special test called manometry where the sphincter relaxes. You put a balloon and inflate to see whether with the inflation of a balloon, whether the sphincter relaxes, opens or no. They become chronically constipated. Week, 10 days, he won't pass. He is getting used to, he is not feeling anything. When there is a spasm, the normal colon tries to push, so there is intermittent cramps, but he is not passing because the sphincter is not opening. Then he won't eat because he feels the abdomen is full, he is not passed food. So, X-ray we'll see now, but X-ray is just to see how much is the stool retained, is the colon already big. The main test is called as pressure study of the sphincter, whether it is relaxing or no.
कृपालू जी महाराज ने बहुत बढ़िया हॉस्पिटल बनाया हमारे लिए या सभी के लिए। हमें बहुत बढ़िया फैसिलिटी मिली है यहाँ पे।
बहुत अच्छा काम किया है महाराज जी ने, उसके लिए धन्यवाद दिया जाता है।
I wish that this all Sansthan grows further and further and is able to help people more and more. I wish from this institute only it becomes a medical college, it becomes something else and you're able to help more and more people for the society.